सर्च करायचं बघूया.
गूगल में, फेसबुक, फेसबुक से पूछो. Hello everyone, I hope I am audible and visible to you. We will just wait for some time so that people can join us for this live session, and then I'll be starting my talk on acne and acne treatments.
मी जास्त यूज नाही करत ना फेसबुक.
Hello Nikhil, good afternoon.
किती टाकू?
ठीक है रहोगे. Fluence 16, energy 4, जो 3 passes. 3 passes. Hello. So let's start. So first I'll introduce myself. I'm Dr. Roopam Mayur Gangurde, MD Dermatologist, hair transplant surgeon and laser surgeon, practicing right now at Skinacea Skin Clinic in Nashik at D'Souza Colony College Road. Today my topic of this talk is acne and acne treatments. So before jumping into treatments, I would like to talk about acne. What is acne? What are the common causes of acne and what are myths related to acne? So we'll just quickly see the anatomy of our skin. So this is the microscopic magnified image of our skin. It's a 3D model. So these are the layers of our skin. So starting from the outermost layer, which is the epidermis, then the second layer, which is dermis, and the subcutaneous fat tissue. So there are few skin appendages situated in the skin layers, like your hair, your sebaceous gland, and the sweat glands. Acne are basically inflammation around this pilosebaceous duct, pilosebaceous unit. So this unit is made up of a hair and a sebaceous gland, which is situated deep in the second layer of our skin. If there is any inflammation or the clogging of this sebaceous duct, there is formation of acne. So in this layman terminology, we call the acne as pimples. We sometimes call them as blackheads and the whiteheads. So depending on the morphology of these pimples, there are different terminology which is commonly used. But in scientific language, it is called acne vulgaris. So acne vulgaris, the type of presentations are various. So starting from a comedon, which is called as a whitehead or a blackhead. So basically comedon is just the blockage of your sebaceous duct. Because of this blockage, it could be because of the keratin, that is the dead skin layer, or because of some oil oxidization of the sebum. This blockage leads to accumulation of sebum deep inside the dermis. If there is oxidized form, if the keratin is oxidized, it looks as a black dot from the outer surface, or it looks as a white dot, just that is sebum collected deep in the dermis. So it is whitehead or a blackhead. Sometimes this sebum gets infected by the bacterial infection or superficial skin microbes like demodex, and there could be development of pus inside, collection of pus inside this pilosebaceous duct, and it looks as a pustular pus-filled lesion from outside, which is surrounded by the red inflammatory areas. So that is when we call them as pustular acne, and these pustular acne sometimes they are painful. If left untreated, there may be development of nodular cystic acne, which is the severest form of acne. So these are basically the type of acne. So let's see what are the common causes of acne. Acne is always multifactorial. There is not a single cause to blame for this acne. So it could be because of genetic predisposition. Maybe one of your parent has this history of acne during their young age, during their teenage. But nowadays what we see, there are more of adult acne cases also. So the reason again for the adult acne are various. So first, as I said, the family history. So family predisposition gives you kind of skin type, that is oily skin type, which is very much prone to development of acne. Then another cause for the acne is again bacterial infections. It could be because of some mites like Demodex mite, which lives on our skin layer. It could be because of the dandruff which grows in your scalp. So when the dandruff grows faster, it could lead to acneiform eruption in your scalp, which we call them as folliculitis. It could lead to acneiform eruptions on your upper back, on your arms, on your chest. So these are related to your dandruff. So acne related to your dandruff. So acne could be present. It could present on your face, or it could present on your trunk also, or on your body parts also. Another common cause for acne eruption is your diet. I won't blame a fatty diet for the acne eruptions. If you have a oily skin, then definitely you should restrict your fat consumption. But what is more commonly seen is the high glycemic index carbohydrate foods are responsible for your acne eruptions. So if you have an acne prone skin, then it's better to stay away from these high glycemic index food products. So what are they? These are the products made up of refined flour, like your white bread, your bakery products, or sugar containing sweets. So stay away from these products. That definitely improves your acne eruptions. There are other causes also for acne eruptions, like in adults the causes could be PCOD. It could be because of consumption of some medication like anabolic steroids or lithium. Some medications can lead to acne eruptions. What we see, the hormonal influence, hormonal disturbances, lot of time it causes acne in adults or in teenagers also. So most common in them is PCOD. PCOD is basically a polymorphic polycystic ovarian disease affecting your ovaries. Because of this, there is a lot of disturbance in your hormonal levels, and it gives you premenstrual flare-up of acne eruptions. In some cases, what we see commonly is hypothyroidism. Then there is a history of weight gain, or history of diabetes in parents, and in kids there is acanthosis nigricans, lot of metabolic disturbances, increased blood sugar levels. It could lead to acneiform eruptions in adults also. Next common cause is what we see is cosmeceuticals. If you are using some cosmeceuticals which are oil based, then it may clog your skin pores and it could lead to acne eruptions. Nowadays in adults stress acne are also seen. So stress, it could be a psychological stress or a physical stress. It could trigger your acne on the face or the truncal parts. So let's move towards the myths associated with acne. So many a times the patient comes to us and they say, ma'am, I was using some lime on my skin, I was putting cucumber on my skin, I put some tomatoes on my skin, I applied some egg yolk on my skin, and now it's irritating or it's burning. See, basically these food products, they get absorbed very well from our gut, from our intestinal system, but they are not good for your skin. If the skin is irritated, if it is sensitive, then avoid such DIY or applications at home. It could irritate your skin and it could worsen your acne. Again, another myth related to your acne is people tend to wash their face more times, and it gives you a drying of your skin, and that irritated skin, the healing goes slowly. The healing is very slow when the skin is irritated from outside. So let's discuss about the type of skin and which is associated more commonly with acne. So if your skin is too dry, the chances of development of acne are there. If the skin is too irritated, then you could see acne on your jawline and the chin area. If the skin is too oily, the acneiform eruptions commonly seen on the T area, that is your forehead and around the nose, because this is the area which is rich in sebaceous gland, and because of the clogging of this sebaceous gland or the infection in this sebaceous gland, there could be development of pimples. So depending on the skin type, you should always opt for your skincare products. Skin types are basically normal skin, dry skin, which is also a sensitive skin, and an oily skin. If you wash your face with a foaming face wash and you feel that your skin is getting tighter and drier after using this foaming face wash, it means your skin is a dry type. So always opt for a moisturizing soft mild cleansers to wash your face. If your skin is oily and acne prone, then you should opt for the face wash which is a foam based face wash, which has either salicylic acid, glycolic acid, or nowadays in market bandylic acid containing face wash, as well as azelaic acid containing face wash are available. So you can use them to exfoliate the dead skin and unclog your skin pores. They are very helpful for the oily skin types. In skincare routine, if your skin is acne prone, then you definitely use a moisturizer. Many patients says after application of moisturizer, my skin feels too sticky. Then look for something like non-comedogenic moisturizers, which helps you to repair your skin barrier system, and it won't clog your skin pores. So in market there are a lot of moisturizers available, medicated ones, which are non-comedogenic. And even if you have a acne prone or a oily skin, you should definitely use a moisturizer. If your screen time, that is if you are spending lot of hours in front of your laptops or your desktops or your mobile, then you can use a IR radiation block, that is a sunscreen which contains chemical and physical filters to block these IR radiations during day hours. And night time you can use your acne gels like retinoids and everything at bedtime. Avoid using your retinoid containing products during day hours when you are outdoor or when you are in front of laptop or mobile screens. So we will quickly move towards the treatment options available in acne treatment. So it starts from oral medications to topical medications. If you are suffering from a pus-filled, pustular, infected acne, then definitely you should go and visit your dermatologist, as this pustular acne requires treatments which is based on oral retinoids, isotretinoin, and oral antibiotics, which will help you to reduce this pustular acne. In fewer cases, when the acne are more of blackheads and whiteheads, in such cases, a good foaming face wash containing salicylic acid, glycolic acid, and a night cream which contains retinoids or salicylic acid can help you. If your acne are nodular cystic, that is a bigger pus-filled acne more on your jawline, then you should definitely visit a dermatologist, which will dermatologist can advise you treatments based on oral medications and some injectables to reduce the flaring and the inflammatory part of nodular cystic acne. If you want a quick results in your acne eruptions, then you can definitely opt for chemical pills like glycolic acid pills or salicylic acid pills. Nowadays we have combination pills which helps more faster in acne cases. In laser treatments, there are a few options like microneedling radiofrequency, which can be done in an active form of acne, but other lasers like Q-switch Nd:YAG lasers and CO2 lasers, they are basically contraindicated in active pustular or papular acne. There are some day-to-day skincare routine there is some day-to-day skincare routine which you should follow at home. So if you have a dry skin, as I said previously, opt for a gentle moisturizing cleansers. If you have a oily skin, then use a foaming face wash. Immediately after washing your face, use a moisturizer, again depending on your skin type. And whenever you put your retinoids or the acne gels, always use them over the layer of moisturizer so that it won't give you irritation and the dryness of the skin. If you have any questions, you can put your questions down in the comment box so that I can help you. Yes, hello Deep, hello Dr. Mahendra, welcome to this session. If you have any questions related to acne or acne treatments, you can put your question in comment section below. I will definitely try to answer them.